We've all been there. You walk into that doctor's office, a place that holds the promise of answers and reassurance, yet you might also feel a knot of anxiety. There's the sterile smell, the hum of the lights, the feeling that the clock is already ticking. For many of us, especially as we get older, these visits can feel rushed, leaving us with more questions than answers. You might leave the office feeling unheard, unsure of the next steps, or even a little frustrated, wondering if you communicated everything you needed to. It's a common experience, but I want you to know it doesn't have to be this way. The truth is, much of this frustration stems not from a lack of caring on the part of your doctor, but from small, correctable habits that can get in the way of clear communication. Think of it like a conversation where both people are speaking slightly different languages. The message gets lost in translation. These aren't personal failings. They're simply common pitfalls that many of us fall into without even realizing it. The good news is that with a little awareness and preparation, we can completely transform this dynamic and make every appointment a truly productive partnership. My goal today is to walk you through 7 of the most common mistakes seniors make at their doctor's appointments. By recognizing these patterns and learning simple strategies to correct them, you can take control of your healthcare journey. We'll explore how to turn a 15-minute rushed check-in into a meaningful collaborative discussion. By the end of our time together, you'll feel empowered to advocate for yourself, ensuring your concerns are addressed, your questions are answered, and you leave every visit feeling confident and clear about your health. Let's start with the moment you walk into the exam room. Your doctor comes in, greets you, and often asks that big, open-ended question. So, what brings you in today? This is your moment, your opening. But if you haven't prepared, it's easy to feel put on the spot. You might mention the first thing that comes to mind, perhaps a nagging cough. And before you know it, the entire visit is focused on that one issue, while the more pressing concern about your dizzy spells or that new pain in your knee gets forgotten until the doctor's hand is on the doorknob. This is the classic unprepared arrival. It's completely understandable. Life is busy, and your health concerns can feel like a jumble of worries in your head. But a doctor's appointment is a finite resource. You have a limited window of time to get the answers you need. Just as you wouldn't go to a critical business meeting without an agenda, you shouldn't go to your doctor without a plan. Walking in cold often leads to a reactive, rather than a proactive conversation, where the doctor leads the discussion based on that first symptom you mention, which may not be your most important one. The solution is deceptively simple. Become a list maker. In the days leading up to your appointment, take out a notebook or use an app on your phone. Start jotting down everything you want to discuss. Think about new symptoms, changes in old ones, any questions you have about your medications, or concerns you've been pondering. Don't filter yourself at this stage, just get it all down on paper. This act of writing is powerful. It organizes your thoughts and ensures nothing is forgotten in the heat of the moment. Once you have your comprehensive list, the next step is crucial: prioritization. Review your list and identify your top 3 most important concerns. These are the must-discuss items. Maybe it's the chest pain you felt last week, the side effects of a new prescription, or the results of a recent test. By identifying your priorities beforehand, you take control of the appointment's agenda right from the start. It shifts the power dynamic in a subtle but profound way. When the doctor asks what brings you in, you can now respond with confidence. You can say, "Thank you for asking. I've made a list to be organized, and the 3 most important things I'd like to discuss today are." This immediately signals to your doctor that you are an engaged, prepared partner in your own care. It helps them structure the visit efficiently, ensuring your most critical needs are addressed first, rather than last. This simple habit of preparing and prioritizing a list does more than just organize your thoughts. It reduces your own anxiety because you no longer have to worry about forgetting something vital. It respects the doctor's time by making the conversation focused and productive. It ensures that even if you run out of time, the most pressing issues have been covered, and you can schedule a follow-up for the less urgent items. Think of your list as your script, your roadmap for the visit. It's your tool to guarantee that your voice is heard and your concerns are central to the conversation. You wouldn't build a house without a blueprint, and you shouldn't try to manage your health without a plan. Starting with a prioritized list is the foundational step to transforming your doctor's visits from rushed encounters into meaningful, effective consultations. So, for your next appointment, I challenge you to try it. Grab a piece of paper a few days before. Write down your symptoms, your worries, your questions. Circle the top 3. Bring that list with you, hold it in your hand, and refer to it. You will be amazed at how this one small change can fundamentally alter the quality of the care you receive and empower you in ways you might not have imagined. The next common mistake is a critical one, and it revolves around something many of us keep in our medicine cabinets: our pills. I'm talking about the failure to bring a complete and accurate list of everything you're taking. This goes far beyond just your prescription medications. It's one of the most dangerous, yet easily avoidable, errors in healthcare. When a doctor asks what you're taking, it's not just a casual question. It's a vital piece of your health puzzle. Many people might only mention the daily prescriptions they get from that specific doctor, forgetting about the heart medication from their cardiologist, the eye drops from their ophthalmologist, or the antibiotic they were prescribed at an urgent care clinic last month. The body doesn't care who prescribed the medicine, it only knows what's circulating in your system. A lack of a unified picture can lead to dangerous drug interactions or redundant prescriptions, putting your health at risk. The problem extends beyond prescriptions. People often don't think to mention the over-the-counter items they use regularly. That daily aspirin for your heart, the ibuprofen for your arthritis, the allergy pills you take every spring. These all matter. And then there are the vitamins, the herbal supplements, and the dietary aids. Things like St. John's wort, ginkgo biloba, or even high-dose vitamin E can have powerful effects and interact significantly with prescription drugs. What you see as a natural supplement, your doctor sees as a potent chemical compound. Keeping an up-to-date, comprehensive medication list is non-negotiable for your safety. This should be a living document. The best approach is to create a master list that you can carry with you. You can write it down, type it up, or use a smartphone app. For each item, you need to include the name of the medication or supplement, the dosage, for example 50 milligrams, and how often you take it. This list should be your constant companion, not just for doctor's visits, but in case of any emergency. An even better method, and one I strongly recommend, is what we call the brown bag method. It's exactly what it sounds like. Before your appointment, go through your home and gather up every single bottle. Prescriptions, over-the-counter meds, vitamins, herbal remedies, ointments, eye drops, everything. Put them all into a bag and bring that bag with you to the appointment. This removes any chance of forgetting something or misstating a dosage. It gives your doctor the most accurate picture possible. Beyond just listing what you're supposed to take, it's equally important to be honest about what you actually take. Do you sometimes forget your blood pressure pill? Do you take an extra pain pill when you're having a bad day? Have you stopped taking a cholesterol medication because you didn't like the side effects? This is not a test, and your doctor is not there to judge you. They are there to help you, but they can only do that with honest information. Admitting you're not taking a medication as prescribed can feel difficult, but it's crucial. If you're having side effects, your doctor might be able to switch you to a different medication that works better for you. If a medication isn't lowering your blood pressure, your doctor needs to know if it's because the drug isn't effective or because you're not taking it regularly. The treatment plan is completely different in those two scenarios. Honesty is the bedrock of a safe and effective treatment plan. So, before your next visit, become a detective in your own home. Your mission is to create that master list or to fill that brown bag. Document everything and commit to having an open, honest conversation about how you're truly using these medications. This single action can prevent dangerous interactions, help your doctor fine-tune your treatment, and ultimately safeguard your health in a profound way. It's a simple step with life-saving potential. Healthcare can be complex, and doctor's appointments can sometimes feel overwhelming. You're processing new information, trying to remember your own questions, and dealing with the emotions that come with discussing your health. In this environment, trying to manage everything on your own can be a real challenge. This brings us to our third common mistake: going to your appointments alone, when you could benefit from having a trusted companion by your side. Many people pride themselves on their independence, and the idea of needing someone to come with them to a doctor's visit can feel like a loss of that autonomy. You might think, I'm perfectly capable of handling this myself. Or you may not want to bother your children, a friend, or your spouse. But I want to reframe this. Bringing someone with you is not a sign of weakness. It's a sign of strength. It's a strategic decision to maximize the value of your appointment. Think of this person as your co-pilot. Their role is multifaceted. First, They are a second set of ears. Studies have shown that patients, especially when they are stressed or anxious, can forget up to 80% of what their doctor tells them by the time they get home. Having another person in the room doubles the chances that crucial information, like medication instructions, follow-up plans, or the details of a diagnosis, is heard, understood, and retained. Your companion can also serve as a dedicated note-taker. While you are focused on the conversation, engaging with your doctor and describing your symptoms, your friend or family member can be writing everything down. They can capture the doctor's exact wording, jot down the names of new medications or specialists, and list out the next steps. This written record becomes an invaluable resource for you to review after the appointment, ensuring nothing falls through the cracks. Furthermore, a trusted companion can be your advocate. Sometimes in the moment, it can be difficult to speak up for yourself. You might feel intimidated or rushed. Your companion, who is one step removed from the emotional intensity of the situation, can help ensure your prioritized concerns are addressed. They can gently interject if the conversation goes off track, saying something like, "I know you also wanted to ask the doctor about the dizzy spells you've been having." They can also help ask for clarification. If a doctor uses a medical term you don't understand, you might hesitate to interrupt. Your companion can step in and say, "Could you explain what stenosis means in simpler terms?" Or, "Just to be sure we understand, you're recommending this test to look for what exactly?" This teamwork ensures you both leave the room with a clear and complete understanding of the situation. Choosing the right person is, of course, very important. This should be someone you trust implicitly, someone who is a good listener, and someone who will respect your privacy. It should be a person who understands their role is to support you, not to speak for you or take over the appointment. Have a conversation with them beforehand about what you need from them, whether it's just to listen, to take notes, or to help you remember your questions. So I encourage you to consider this for your next important visit, especially if you're discussing a new diagnosis, a complex treatment plan, or significant symptoms. Ask a trusted family member, a close friend, or a neighbor. Frame it not as a favor, but as an invitation for them to be part of your healthcare team. The peace of mind and clarity that come from having an ally in the room is immeasurable. It's a simple, powerful strategy to ensure you get the most out of every single visit. Now let's talk about the things we don't say. There are certain health topics that can feel awkward, embarrassing, or even, a little bit shameful to discuss. Issues related to bladder or bowel control, memory lapses, sexual dysfunction, depression, or even something as simple as foot odor. The fourth common mistake is downplaying, hiding, or completely avoiding these minor or intimate symptoms. We tell ourselves, "It's just a part of getting older," or "The doctor is too busy for this," or "I'm too embarrassed to bring it up." But here's something I want you to hear, and to truly let sink in. Your doctor has heard it all before. I can promise you that whatever you are experiencing, you are not the first patient to bring it to their attention, and you won't be the last. Doctors are medical professionals, but they are also human beings trained to handle sensitive information with discretion, professionalism, and compassion. Their goal is to improve your health and your quality of life, and they simply cannot do that if they don't have the full picture. What you might dismiss as a minor inconvenience could actually be a clue to a more significant underlying medical condition. For example, frequent urination might not just be a weak bladder, it could be a sign of diabetes or a prostate issue. Those small memory slips you're worried about could be related to a vitamin deficiency, a medication side effect, or the very early stages of a cognitive issue where early intervention is most effective. Ignoring these symptoms doesn't make them go away. In fact, it often allows them to get worse, impacting your quality of life in some really profound ways. An issue like incontinence, for instance, can lead to social isolation because you become afraid to leave the house. Untreated depression can rob you of joy and energy. These are not small things. They are central to your well-being, and very often, they are treatable. So how do you broach these sensitive topics? It can be helpful to practice what you're going to say. You don't need a long, detailed speech. Sometimes the easiest way is the most direct. You can start by saying, "There's something a little embarrassing I need to discuss," or "I'm not sure if this is important, but I've been experiencing." This signals to the doctor that this is a sensitive topic for you and allows them to create a safe space for the conversation. Another strategy is to use your written list, which we discussed earlier. Sometimes it's just easier to write down a sensitive symptom than to say it out loud. You can write trouble with bladder control or feeling very sad lately on your list, pressure off of you to find the right words in the moment. It opens the door for the doctor to ask follow-up questions in a gentle and professional manner. Remember, the things that affect your daily life are never minor. If a symptom is bothering you, affecting your confidence, limiting your activities, or causing you distress, it is important. It is worthy of medical attention. Your doctor chose this profession to help people with exactly these kinds of problems. They have solutions, treatments, and strategies that can dramatically improve your situation, but they can only offer them if you let them in. Please, do not suffer in silence. Your health includes your physical, mental, and emotional well-being. By being brave enough to mention that one embarrassing symptom, you might not only find a simple solution that restores your quality of life, but you could also be giving your doctor the key piece of information they need to protect your long-term health. Your voice and your experiences matter, all of them. The doctor has finished the examination. They've explained their diagnosis, and they've outlined a treatment plan. They might say something like, "Any questions?" This is a critical juncture in the appointment, and it's where our fifth mistake often occurs: not asking questions or failing to ask for clarification before you leave the room. You might nod your head, even if you're feeling confused, because you don't want to seem difficult or take up more time. You leave the office, get to your car, and suddenly realize you don't know when to take the new medication, what the side effects are, or what the next steps truly are. This moment of departure is your last, best chance to ensure you are leaving with clarity and confidence. Uncertainty leads to non-compliance. If you're not sure why you need to take a medication, or you're fuzzy on the instructions, you are far less likely to follow through correctly. This can undermine the entire purpose of the visit and potentially harm your health. Asking questions is not a sign of ignorance. It's a sign of engagement and a commitment to your own well-being. One of the best ways to combat this is to prepare your questions in advance, just as you prepared your list of symptoms. As you're thinking about your health in the days before your visit, jot down any questions that come to mind. Why am I getting this test? What are the alternatives to this medication? What lifestyle changes could help with this condition? Having them written down ensures you won't forget them during the appointment. During the visit, if your doctor says something you don't understand, whether it's a medical term, a diagnosis, or an instruction, you must speak up in that moment. It's perfectly acceptable, and in fact, it's your right to say, "I'm sorry, I don't understand. Can you explain that in a different way? Or can you spell that word for me so I can look it up later?" A good doctor will welcome these questions because it shows you are an active participant in your care. A powerful technique to ensure you've understood everything correctly is the teach-back method. After your doctor has explained something, you can say, "I want to make sure I've got this right." So, what you're saying is, "I should take one of these blue pills every morning, and I need to schedule a follow-up appointment in 3 months. Is that correct?" This simple act of repeating the plan back in your own words is one of the most effective ways to catch any misunderstandings before they become problems. Before the doctor leaves the room, make it a habit to ask one final, crucial question. "Can I get a written summary of our visit?" Many electronic health record systems can print an after-visit summary that includes your diagnosis, medication changes, and follow-up instructions. This document is worth its weight in gold. It's a concrete reference you can take home, review at your leisure, and share with the family member or friend who might be helping with your care. If a formal summary isn't available, don't hesitate to use the notes your companion took, or your own notes, and quickly review the key points with the doctor. So, just to recap, the plan is A, B, and C. This final check-in can make all the difference. It transforms a vague cloud of information into a clear, actionable plan that you feel confident in executing. Never leave a doctor's office feeling confused. Your health is too important. Remember that you are the consumer in this interaction, and you have a right to understand the service and advice you are receiving. Empower yourself by preparing questions, asking for clarification in the moment, using the teach-back method, and always requesting a written summary. This ensures that the value of the appointment extends far beyond the exam room walls. The sixth mistake is all about timing. It can manifest in 2 different ways. First, not being strategic about scheduling routine or follow-up appointments. And second, and more dangerously, waiting too long to seek care for a new or worsening symptom. Both of these timing traps can have a significant impact on your health outcomes. Let's start with the logistics of routine visits. Many people will take the first available appointment, which might be a 15-minute slot at 2 o'clock on a busy Tuesday. This can be a setup for a rushed and unsatisfactory visit. If you know you have multiple or complex issues to discuss, it's wise to be strategic when you schedule. When you call the office, you can say, "I have a few important things to discuss with the doctor. Would it be possible to get a longer appointment slot?" Sometimes this is possible, or they may suggest a dedicated follow-up. Another scheduling tip is to try to get the first appointment of the morning or the first appointment after lunch. Doctors' schedules tend to get more and more backed up as the day goes on. An early appointment means your doctor is more likely to be on time and mentally fresh, giving you their full attention without the pressure of a waiting room full of patients behind you. It's a small logistical change that can make a big difference in the quality of the interaction. Now let's talk about the more critical timing error delay. It's a common human tendency, especially for a generation taught to be stoic and not to complain. You feel a new pain, or a familiar symptom gets worse, and you think, "I'll just wait and see if it gets better," or "I have an appointment in 2 months, I'll just bring it up then." This wait-and-see approach can be a gamble with your health. Many conditions, from infections to heart disease to cancer, are most treatable when they are caught early. A symptom that seems minor could be your body's early warning system. For example, new or worsening shortness of breath isn't something to wait on for 2 months. It could signal a problem with your heart or lungs that needs immediate attention. A persistent headache, a change in bowel habits, a wound that won't heal. These are all signs that warrant a timely call to your doctor's office. I understand the hesitation. You don't want to be a hypochondriac or clog up the healthcare system with minor complaints. But you are the world's leading expert on your own body. You know what's normal for you. If something feels different, new, or is getting progressively worse, that is always a valid reason to seek medical advice. Trust your intuition. When you call the office, you don't necessarily have to demand an immediate appointment. You can simply say, "I'm calling because I have a new symptom that's concerning me," and describe it to the nurse or medical assistant. These trained professionals can help triage the situation. They might tell you it's something that can wait for your next appointment. They might advise you to come in sooner, or they might direct you to an urgent care center or the emergency room if the symptom is serious. Don't let the fear of being dismissed prevent you from making that call. Proactive communication is key. By addressing issues as they arise, you're not being a bother. You're being a responsible steward of your own health. Waiting until a small problem becomes a big crisis is far more stressful and difficult to manage for both you and your doctor. So, be strategic with your scheduling, and please, listen to your body and don't delay when it's telling you something is wrong. The doctor's visit doesn't end when you walk out the door. In fact, what happens after the appointment is just as important as what happens during it. This is where our 7th and final mistake comes into play. Not following up on instructions, referrals, or test results. You can have the most productive appointment in the world, but if you drop the ball on the follow-through, all that effort can be wasted. You get home with your after-visit summary or your notes. It's easy to put that piece of paper on the counter, get distracted by the mail or the tasks of the day, and completely forget about it. The instruction to schedule a blood test, the referral to a physical therapist, the recommendation to start a new walking routine, these things can easily slip through the cracks if you don't have a system for follow-through. The first step is to review your notes or the visit summary as soon as you get home, while the conversation is still fresh in your mind. This is the time to translate instructions into actionable tasks. If you need to make an appointment with a specialist, like a cardiologist, put a reminder in your calendar or make the call right then and there. If you need to start a new medication, make sure you understand when and how to get the prescription filled. Setting reminders is a powerful tool. Use your phone's calendar, a wall calendar, or even just sticky notes. If the doctor said to check your blood pressure twice a day, set alarms on your phone to remind you. If you need to schedule a follow-up visit in 6 months, make a note in your calendar for 5 months from now to call the office. Don't rely on your memory alone. Create an external system to keep you on track. Another critical area of follow-up is test results. A common assumption is no news is good news. People get blood work or an X-ray done and, if they don't hear back from the doctor's office, they assume everything is normal. This can be a dangerous assumption. While offices are supposed to contact you with all results, in a busy healthcare system, things can and do get missed. A result can be misfiled, a message can be lost. You must be your own advocate in this process. When you get a test done, ask when you should expect to hear about the results. If you haven't heard back by that time, you need to call the office. It's a simple, proactive call. Hello, I'm calling to follow up on the results of the blood test I had last Tuesday. This ensures that you receive the information you need and that no important findings are overlooked. The same principle applies to referrals. If your primary care doctor refers you to a specialist and you don't hear from the specialist's office within a week or so, don't just wait. Call your primary doctor's office back and ask them to confirm that the referral was sent. Then, call the specialist's office to make sure they received it. It may feel like you're doing extra work, but this active management ensures you get the care you need in a timely manner. Ultimately, follow-through is about closing the loop. It's about taking the plan you and your doctor created together and turning it into reality. Your health outcomes are directly linked to your ability to execute this plan. By being organized, setting reminders, and proactively following up on tests and referrals, you take ownership of the entire care process, from the exam room to your daily life. This is the final, crucial step in becoming a truly empowered patient. We've covered a lot of ground today, from the power of a simple list to the importance of following up. By avoiding these 7 common mistakes, arriving unprepared, hiding your medications, going alone, downplaying symptoms, leaving with questions, poor timing, and dropping the follow-through, you can fundamentally change your relationship with your healthcare. These aren't just tips for a better appointment, they are strategies for taking active control of your health journey. It's about shifting from being a passive recipient of care to being an active, respected partner with your doctor. This partnership is built on preparation, honesty, and clear communication. I know this might feel like a lot to remember all at once, so don't feel pressured to change everything overnight. The path to empowerment is taken one step at a time. For your very next appointment, I encourage you to choose just one of these strategies to focus on. Maybe you'll commit to creating a prioritized list of your concerns. Or perhaps you'll bring that brown bag of all your medications. Just pick one, try it, and notice the difference it makes in how you feel and how the appointment unfolds. Small changes can lead to profound results. Ultimately, the most important message I want to leave you with is this: you are your own best advocate. No one knows your body, your symptoms, or your life better than you do. Your voice matters. Your concerns are valid. Your questions deserve answers. By equipping yourself with these simple tools, you empower that voice and ensure that it is heard, loud, and clear. You have the power to build a stronger partnership with your doctor and to navigate your health with confidence and clarity. Thank you for taking this time for yourself today. Be well.